As our in-depth report on the Philippines concluded, we begin a new series on the country Indonesia. To better protect the health of their countrymen in 2014, the Indonesian government launched a national health insurance program, offering 3 different types of insurance, with poor families being completely subsidized. Current statistics show that more than 70% of the population is now covered by the national health insurance. 2 years after full implementation, although the program seems ideal on paper, problems still remain. Let's find out more.
This fishing port is next to a small market where elderly women go to purchase food. Besides weighing the food, there's always a little bit of negotiation involved. According to statistics, the number of poor in Indonesia is about 28 million, or approximately some 11% of the country's population. Those that are wealthy are very wealthy. When the general public becomes sick, they typically have no money to see a doctor, simply going to a general store for medicine. The store doesn't have a pharmacist license, but it does sell painkillers and other common medicines in bulk. The prices can be as cheap as a few cents, which is the only relief the poor can get.
Before going to the hospital, if I have a headache, I'll go to a general store to buy medicine. I have no money, so I don't know what else to do. Although there's the PBJS National Health Insurance, I can afford transportation costs, so I don't go to the hospital.
60-year-old Wastia suffers from thyroid cancer. Her son is also in poor condition after a car accident. Both mother and son live in poverty and have no way to return to the hospital for a follow-up visit. Ziji's free medical clinic has been a lifesaver for them.
Lacking medical resources is one reason, and for some rural areas, there are just 2 to 3 hospitals, which have to serve a lot of people. And to travel from the country to the city comes with great cost when it comes to transportation.
There are 3 general categories of insurance offered by the Indonesian government, which started to offer coverage in 2014. The most affordable is about $2 a month, but some people can't even afford this payment.
When we go on home visits, we see those that are impoverished that can't pay for as little as $2 in health insurance fees. This is a big burden on them, as they don't receive any benefits.
With the public unable to afford health insurance, the government is trying to solve this problem. And as long as one is able to prove they meet the standard for poverty, all health insurance fees will be paid by the government in full. So far, in the 4th year of the program, the number of insured continued to increase. Just last year, this number has reached 176 million. But finding the money to implement this policy has been difficult, as preliminary estimates by the Indonesian Health Insurance Bureau indicates an annual budget shortfall of $6.7 billion in national health insurance.
The money we collect comes from health insurance premiums, and it sort of circulates, meaning that even though we are healthy, we pay, and this helps the sick people. In fact, the law says that all those living in Indonesia or foreigners working here for more than 6 months must apply for BPJS health insurance.
The Indonesian government said the program will be fully compulsory by 2019. However, an uneven distribution of resources has been a big problem. For example, the proportion of hospital beds is just 6 for every 10,000 people, with the proportion of medical staff being similarly low, with just 2 staff for 10,000 people. This ratio is well behind standards in Europe. Now that many in Indonesia have health insurance, they may not have enough doctors for everyone. There's also a rumor going around that due to hospitals seeking profit, they will give priority to patients willing to pay their own expenses.
The hospital works on a first-come, first-served basis and doesn't reflect those who pay more in health insurance fees. Now, hospitals will ask patients whether or not they have health insurance. They do this to protect the rights of patients, as well as making sure they don't lose money.
At present, Indonesia has nearly 26,000 medical institutions that are now cooperating with national health insurance units. Indonesia's medical problems have begun to interest neighboring Singapore and Malaysia, who have identified potential business opportunities. In 2015, Singapore launched a medical visa package where for the same price one can enjoy better medical services, attracting many interested parties.
Singapore and Malaysian doctors have better equipment to diagnose patients and are much more advanced than Indonesia in this way. Also, these physicians speak English, making them more international, which is also a great advantage.
Wanting to improve the quality of medical care shouldn't only be dependent upon foreign technology. Taiwan's Nordhof Craniofacial Foundation in 2008 for the first time visited Indonesia to perform cleft lip and palate surgery, including cooperation with the health ministry to send seed instructors to Taiwan.
Taiwan, in terms of technology as well as the entire medical process, such as management, has all been done quite well. We have also cultivated a craniofacial team, teaching doctors not just to do cleft lip and palate, but also microtia surgery.
Serving at Central Hospital are 3 physicians who have trained at Taiwan's Chang'an Memorial Hospital to do craniofacial surgery, as well as learning how to serve as a doctor.
Chang'an Memorial Hospital's craniofacial center is very good. We're now also trying to move forward in this direction. The Nordhof Craniofacial Foundation has provided scholarships to youth to help us establish a similar craniofacial center in Indonesia that is comparable to that of the Chang'an Memorial Hospital Craniofacial Center.
Other countries will often send their difficult patients out of the country to treat. However, Taiwan doctors are special because they make every effort to treat and rescue their patients. Even now, when I encounter difficult medical problems in Indonesia, I will write to Taiwan physicians for consultation.
Here we can see the demand for medical services in this country. The Sekaran Tsuji Hospital began as just a small clinic, but in 2008 was reconstructed to become a hospital, adding more medical categories to enhance medical service quality. Now next to the Jingse Hall in Indonesia, a Tsuji General Hospital is being built.
Tsuji Indonesia chapter from 2013 has been planning the construction of a comprehensive general hospital in Jakarta. Work is expected to be completed after 2 years, will bring a different perspective to medical care in Indonesia.
We have a lot of cases of bone marrow transplant surgery taking place in Singapore Central Hospital. Indonesia has no way to do such a procedure. We're planning to have both a surgery center and care wards here.
Tsuji's medical plan has taken root and is beginning to spread to include more medical services. After operating a clinic for more than 10 years, it has learned more about difficulties that Indonesians face, as well as how to overcome the gap between urban and rural areas to alleviate some of the distress and worry that some encounter when seeking medical care.